Well, welcome to the Northwest Indiana COVID-19 report for Tuesday, April 25th, 21st. I'm Michael Puente with Bill Moran and special guest today, the Michael Gonzalez, who's the mayor of Gary's Jerome Prince's spokesperson. Hey, Mike, how are you?
Doing great, guys. Thanks for having me on.
And how you doing, Bill?
Oh, I'm doing great. It's been a
All right.
busy day
I
for
know,
us, but I'm doing great.
right. And we got started a little late today just because it's been kind of a busy day, but we want to thank everybody who's looking at this. We've got some news to report on the latest on the coronavirus because it just doesn't seem to go away. One of the things we like to do, of course, is go over the numbers. Today, as he's been doing the past 3 or 4 weeks now, Indiana Governor Eric Holcomb held his daily press briefing in Indianapolis. And that's where he was joined, of course, by Indiana State Health Director, Dr. Christina Box. And she gave us the latest numbers as it pertains statewide. And this is what she had to say.
So as you can see, we had 431 new cases that were reported in the last 24 hours with unfortunately 61 deaths reported. I think the important thing to notice here is those 61 deaths were spread out over a number of days. And as I've already highlighted in one of the slides, I think you've seen, it's very important to note that those came just in the last 3 days over the weekend.
And that's Dr. Christina Box, who's head of the Indiana State Health Department. And it's also important to note that just yesterday, and this is how these numbers can be deceiving. And early on, when I was reporting the numbers, I would kind of get caught up in the actual number. Where yesterday they reported 7 deaths. So you might be thinking, wow, 7 deaths? That's not too bad considering it was Saturday, Sunday, and Monday. Actually, she even says the numbers that are reported actually come in a little bit a little bit low over the weekend, a little bit slow. So then it shot up today with the numbers today, and it's another 44. That's 61 deaths just today. That's 636, 61 more. And as I try to do is to try to break it down for what it means for Northwest Indiana. So let's go over the numbers there. So again, uh, for Lake County, we have 1,227 confirmed cases of COVID 19, 54 deaths, that's 7 more, with 5,791 people tested. That's 152 more than just from yesterday. Porter County has 180 people confirmed with the virus, 5 deaths, that's 2 more, and 1,304 people tested, about 25 more. And we'll just go over LaPorte County. 140 people positive tested for COVID 19, 5 deaths, and 914 people tested. I tell you what, let me go on a little bit because I have been doing Newton, Jasper, and Stark so they don't feel left out in case they're looking. 33 positive, 4 deaths, 104 people tested for Newton County. For Jasper, 26 positive, 1 death, 32 tested. And for Stark County, 11 positive, 1 death, and 131 people tested. So as you can see, these numbers can really play with you. 1 minute you're thinking, oh man, we're getting a little bit better. Then the shoe drops with you get more bad news on that. So Bill, what are you making of all these numbers?
Well, actually, just to confirm what you said, we had uh, the director on from the Central Emergency Command, District 1, and she said pretty much the same thing you did. They always are cautious about the numbers over the weekend because they're worried about who is down in Indianapolis to put the numbers together and report them. So, yeah, and the thing is, that yeah, we do. In fact, what I saw over the weekend, I was kind of hopeful that we saw some leveling off. But as you said, there was a kind of a spike coming up when those numbers caught up and the health department actually reported on them. Some of the things I'm still looking at, in total test kits available, we've only tested 2% in Marion County and 1% in Lake County. So, I mean, yeah, our numbers are only as good as the amount being tested.
You are reported this week in a story I did for WBEZ that the test up until about 2 or 3 weeks ago had been running 4 or 5 times more in Marion County than Lake County. If you just go with the raw numbers and not do it by percentage of population. And even today, they have about 20,000 people tested, almost 20,000 compared to Lake County's. I don't even think it's 6,000. So um, I just said those numbers. You would think I would have them memorized. Total tested for Lake County, 5,791. So that's more than 3 times as much in Marion County than Lake County. Not as much as 4 times, just in sheer numbers. And that's where a lot of people have been complaining about. And before we get to our guest, Mike Gonzalez, who is the spokesperson for Jerome Prince, his boss, the mayor of Gary, Jerome Prince, he joined Governor Holcomb today at the daily press conference. Let's hear a little bit about what Mayor Prince had to say today down in Indianapolis.
Well, thank you, Governor. And certainly I'm glad to be here with you and Dr. Box, as well as Mayor Moore, who I'm not sure if we met before. So hello, Mayor. Yeah, but you're right, Governor. Since the beginning of, well, certainly not the very beginning, but since things ramped up in the state of Indiana, we as a community have been, at least from our perspective, abreast, or at least attempting to stay abreast of all of the current trends and data.
And that's Gary, Indiana Mayor Jerome Prince. And joining us here today on the Northwest Indiana COVID-19 report is longtime journalist, now former journalist, now spokesperson for the mayor, Mayor Jerome Prince, is Michael Gonzalez. Mike, and again, welcome to the COVID-19 report.
Thanks, Mike. Thanks, Bill.
Michael, I got to ask you, I don't know, since he's had his appearance this afternoon, the mayor, any feedback from him? Did he like his performance? I'm sure he wishes he had a little bit more time there. Any feedback from him?
Well, certainly, we appreciate the opportunity to actually get those points across. It's a very small time frame, so you try to do the best you can with that. We did talk afterwards. He was able to get some points in that limited time. But then there were other things that came up, like a couple questions that you asked that fleshed out some important points. And don't forget, we're always just constantly communicating with a number of different audiences. So you can be sure that whatever we may not have gotten today, we will make opportunities to communicate even tomorrow.
And I want to tell people that if they have a question, if they're watching on Facebook, that you can ask your question in the comment section. And so want to thank people for that if they have any questions there. And we're thanking them for watching. Mike, one of the things that, my story touched upon a little bit about today is, again, ongoing testing in Northwest Indiana, in Lake County. That's still somewhat of a critical sore point for folks in Northwest Indiana. Does it seem like, from what you've been hearing, is it starting to ramp up a little bit?
So I think it is still a sore point, and for a lot of people, rightfully so, because we don't. A lot of people feel like there's just not enough testing going on. I think that I don't particularly understand the testing protocol that the State Department of Health is using, but I will say that there's been testing going on. So, for example, the state of Indiana is going to be in the city of Gary again tomorrow is the final day. So that makes all of last week, 3 days this week, that the state of Indiana conducted testing at St. Timothy's Church, 1600 West 25th Avenue. So there's probably close to 1,000 tests that have been done there. And then when you look at Methodist Hospital, I think Community Health Net and maybe Edgewater. So there, at least in the city of Gary, there are other places that are doing testing. It's hard to really know how much testing should be done by way of number, but certainly when you see that Marion County, for example, twice the size of Lake County, is testing 4.5 to 5 times, or was testing 4.5 to 5 times, that's going to raise questions about the amount of testing that's actually being done. I think the key here is, if you don't feel like you're getting enough testing in a populated area like Lake County, it's really hard to get a sense for how present that virus is in Lake County. You just saw how prevalent it is in Lake County.
I don't think anybody really expected Lake County to have more testing than Marion County. Marion
Certainly
County is
not.
the
No.
capital. But at the same time, early on in these conversations with the governor and Dr. Christina Box, and mindful, look, they're under this pressure cooker, they're under the spotlight. That's what they get paid the big bucks for, to be under that spotlight. And we're in a really difficult time right now. But it just seemed like I do got to kind of agree with the Indiana State Representative Mara Candelaria Reardon when she says it's been a very Marion County centric response to this COVID-19 pandemic. When I asked a couple of weeks ago if they were monitoring communities close to the border, Lake County, Indiana, Northwest Indiana, so close to Chicago, they said, yeah, we're kind of monitoring other big cities, Cincinnati, Louisville. I mean, you could combine those two cities and you still wouldn't get Chicago. So they should have been, in my estimation, really looking at how Cook County was going to affect Northwest Indiana, because you're sitting right next to the third largest city in the country and the largest by population um, county in the country, Cook County. And there's a lot of travel back and forth, people working, and we all know we're here. We know how it is. So it just seems like, I mean, obviously they said Indianapolis was a hot spot, but you didn't know if Northwest Indiana was a hot spot because there was inadequate testing.
And I can't argue that point because I don't think there has been adequate testing. But I do think so. One of the things that you have to do now is you accept where we are with testing. I really hope that the State Department of Health will do a probably more thorough job of explaining this testing protocol to determine how are they in fact doling out these tests? How are they allotting these tests? And as far as to your point earlier today, the question that you raised, when you talk about such a porous border with Cook County, the largest, most densely populated county in the country, we have to take other steps, which is why we have been talking extensively with the state and federal governments through the U.S. Army Corps of Engineer and the Indiana National Guard about a field hospital. And then you probably heard General Dale Lyles today say that the medical augmentation packages, which is sort of these 50 portable hospital rooms, so to speak, are going to be moved to Gary, to an undisclosed location, and will be ready as needed. So if you can address the testing, if we're not clear on whether or not there's going to be more testing, then we really began to put more effort into how do we address the sick people. So how do we get a field hospital? How do we get resources up here to help them if they begin to overwhelm the health system that we have? And by the way, NISA, the Northwest Indiana Information Security and Sharing Alliance, which covers 5 counties in District 1, they've also been very helpful in trying to get ventilators and trying to get the infrastructure set up so that if we have that surge, our medical facilities can respond to that.
Let me play some audio where there was a little bit discussion of another big. Hopefully, I got this audio lined up right. Sometimes I'm working too fast.
Michael.
Okay, here I do. Okay, so I asked 2 questions today down at the for the press conference. I wasn't down there. Obviously, it's done through Zoom, the Zoom technology. But I did ask 2 questions because yesterday, Hammond, Indiana Mayor Tom McDermott Jr. made a point that, and it looks like Chicago and the state of Illinois are going to open perhaps later than Indiana. Indiana's still looking at that May 1st deadline. And already we're seeing reports in the Chicago Tribune that Mayor Lightfoot is predicting that the state stay-at-home order for Illinois may go all the way into June. So what happens if Indiana opens up before Chicago and, of course, the state of Illinois? And that's the concern about Mayor McDermott has, and that he could draw so many more people from Chicago into Hammond, which normally that's what they want. We want Chicagoans coming into Indiana to shop and spend their money. But in this case, maybe not, because it's a hot spot. And this is what they had to say. And they also touched upon the issue of the field hospital in Gary. So here goes the question.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor, and good afternoon, Dr. Fox. I
appreciate your daily update. Governor, I have two questions. One, the mayor of Hammond yesterday mentioned that he's concerned that once Indiana opens and before the state of Illinois, that there could be a floodgate open of people from Chicago coming over the state line to do business. Is there any concerns about that? What can be done? And also, I know in Gary, the Army Corps of Engineers was close to setting up a field hospital. What's the status of that? And because Gary is now seeing about 25 new cases a day.
I will buy the Adjutant General Lyles 30 seconds here and answer your first question first, and he can get to the second question that you just had. Mayor McDermott is right to be concerned. So are we, not just on the Lake County border, but every county that touches another state in Indiana. And that's why we're taking a collaborative approach. That's why I'm working with the governors in our region, and in fact beyond that, but the Great Lakes region, we're all in contact about any moves that we might make. And so while we're not dependent on them, we want to make sure that when we do make a move, that it's the right move in that region. And that's why, I often talk about there is no one size fits all. There is no one region that's exactly like another region. Whether you look at, like we did today, Jeffersonville and Gary, Indiana, they're just different, and they have different, Louisville and Chicago metropolitan areas right on the other side of the border. And so he's right to be looking at that, and we'll continue to work with not just the mayor of Hammond or Gary, but that whole region before we make any decisions. And General, you want to talk about the position that we're in right now in the region?
Sure. So yeah, the local surge plan in Gary has been at the forefront of our thoughts because of the potential for movement from Chicago into the Gary area. And so working with the mayor and also working very closely with Dr. Walker, we have done site reconnaissance at the Genesis Center as well as a high school there in Gary. And what our surge plan will be for the Gary area is we will pre-position a surge capability called a medical augmentation package, which consists of 50 beds that we could potentially put at any place in the Gary area. And we'll have that pre-positioned and set up to handle any surge requirements in the Gary area by the end of the week. And so that's what our surge plan is there. We're staying very cognizant of what's going on in Gary, working very closely with the Commissioner of Health to understand what would trigger that. And so the conditions are set to do that. Thank you.
Thank you, General.
Okay.
And as you can see there, just talked about that very issue about the field hospital. They still haven't selected the exact location for that, but hopefully that happens. And Mike, I mean, this is all speculation on my part, but I kind of feel that they're setting up all the field hospitals and getting people prepared. And even if you go over there to Chicago with everything with at McCormick Place setting up as Illinois' largest hospital now with 500 beds over there, it's setting up so when we go back to work and people get sick, they have a place to go.
So very good point. And it's not as speculative as you might think. So right now, or so at the end of this week, as the general said, those maps will be sent to a safe location in Gary. And in the meantime, they continue to scout out the right location. People will be going back to work. If Indiana opens up before Illinois, people will be coming to Indiana to do shopping, to buy, to travel. So we are going to increase our exposure rates. So the key is to have the material that you need in a location where you can relatively quickly build the field hospital. It's going to require contractors, electricians, and it's going to require other types of carpenters. It's going to involve the trades folks. So you have to have a location. You want the maps in place. So when that surge occurs, and for example, we saw 25 a day over the past weekend, right? We haven't hit the surge yet. Once we hit that surge, who knows how many we'll be seeing a day? If you overwhelm your system, your medical system, at least now you have the MAPs in place. you will have scouted out the location, you will have prepared that location. So it's sort of like hitting go, setting it up, and you're ready to go for the patients.
And again, you're listening and looking at the Northwest Indiana COVID-19 report for Tuesday, April 12th. I'm Michael Puente. You can hear me on WBEZ and on my show Off Mic on Lakeshore Public Radio on Fridays at 11. And I'm joined by Bill Moran of the Bill and Callie Show and Mike Gonzalez, who's the spokesperson for Gary, Indiana Mayor Jerome Prince. We're just going over the numbers. If we do this, we've been doing this now for a few weeks, to expand on the information we're getting, because we do get a lot of coverage from Chicago, but not enough, in my opinion. And Indianapolis is too far to worry about. Northwest Indiana and South Bend is too far. So we do this as a way for you guys to catch up with the latest news, because, I think one of the reasons why I do this is because I'm seeing a lot of complacency out there. Even the mayor of Hammond mentioned it yesterday. You're going out. I think it's pretty much hit and miss. You go to a store, you go to Strack and Van Til's, you go to Menards. I'm not seeing that many people wearing the mask. I see some, but not a lot. And I think maybe some people just, I'm not going to worry about it. And maybe it looks silly or whatever. I've been trying to wear my mask as much as possible. What are you guys seeing out there? Are people getting too complacent? Are you wearing your mask, or do you think, who needs a mask?
Well, I know what I've seen, and Kelly and I have had to go out a couple of times because we're actually moving. Not a thing you should do during this, but there's a very good reason why. It's for health reasons. But no, first of all, 2 weeks ago, I thought people were very complacent. We purchased masks from a friend that made them in LaPorte, and we wear them every time we go out to a store or anywhere where we know we're going to encounter other people. But I've got to say, 2 weeks ago, we were a minority. A very few people wore them. Now, it's almost like a switch came on, and I know Strax, they've had some concerns because they've reported a couple employees that had been infected. So when we entered a Strax just recently, as 2 days ago, it was, 2 weeks ago, they were pretty lax. You could go in, I could be with Kelly, we could go around, and very few people had masks on. 2 days ago now, we were being gauged. You had to go into a specific entrance into the Highland store, and a sign clearly said only one person per family, one cart per person. So there were heavy restrictions on there. Going to Whole Foods, which we go to for stuff that we can't find at Strax, very similar situation, except they also had a gauging input. They would only allow a certain amount of people into the store. So it seems like over the last 2 weeks, the stores have stepped it up. Now we go to a Menards just recently. Again, we were a minority, but again, you have a lot more people in there, and I was really concerned, to be quite honest with you. What I saw, it just, and that's one of the essential businesses. They're allowed to be open, but yet it seemed like very few people were wearing masks. I will say all the employees were, but people were out, violating the social distancing rule of 6 feet. It was a mess.
So we haven't been out of the house. We have been very literally quarantining ourselves, my wife, my 2 kids, and I, for about a week and a half. It literally has been probably, I don't even know when, 12, 11, probably the 9th or 10th since I went to a store, April 9th or April 10th. We do go for walks, the kids and I especially. So we go for walks around the area. I don't see anybody else wearing masks when we're out and about, but that's different. You're not in an enclosed area. There aren't that many people out. Mm-hmm. I have heard complaints actually about Menards. Funny you should say that. So one of my Facebook friends who's involved with the U.S. Census mentioned that he was in the minority. And that's an enclosed place, and you're within 6 feet of people oftentimes, at least.
I was in the St. John area over the weekend and passed by the Target that's right next to Strack and Van Til's, right nearby. I think it's by El Sib Garden. and the parking lot was just packed. I'm not trying to be the COVID-19 wear your mask, social distancing cop, but in just my observation, it just looked like what stay-at-home order. This thing is just, it just feels like maybe there's just different rules for different people, and it people were out, and people might say, "Well, you were out, Mr. What are you doing out there?" True, you're right. I was out. I was doing something.
So
So guilty as charged. But that's just observant. What's happening out there. If you have a question for us, you can write it on the Facebook page on the Bill and Callie Show. And again, we want to thank Bill Moran here for helping me to do this. I started out this kind of solo, and he's got the technology, he's got the wherewithal, and we're reaching more people. So that's the point of it, to get more people. It's not to show my mug on here because, again, I tell people, if you're going to listen to this at home, you don't have to look at us. You can play it as a podcast, play it over your speaker or something. It's just to get the information out. We do have a question here by Jorge Lara. I'm not going to lie, he's a friend of mine, but he's a loyal watcher of this. So I really appreciate Jorge. Thank you, Jorge. He asks, Gary may have been affected so much because it's close to the expressway and the South Shore train, and many people commute back and forth to Chicago to work. Could that have how some of the virus may have been transmitted here? He doesn't actually talk like that. That's just me. but well, I'm thinking, yeah, probably, but this virus has shown up in the most obscure places around the world. So it's hopping everywhere. It's I've seen it in countries in Africa that you're like, wow, it's over there too. My God. So this thing is just traveling. It's jumping on people. It's jumping on whatever, and that's how it's being transmitted. And yeah, we're probably getting a little bit higher because we have a lot of people going into Cook County and vice versa. People working in the mills. So too bad we don't have technology, some glasses made by Tony Stark where we can see exactly who has the virus and who doesn't. That would make life so much easier.
I'm sorry, guys. Hang on just a moment. Good night. Okay. Well, here's the thing. It's a waterborne. Can you hear me?
Mm-hmm.
Yep.
Okay. My understanding, it's a waterborne. It's droplets, water droplets. You sneeze, you talk, you say goodnight to your kids, whatever the case. It causes to be airborne. We don't really know how long the virus. We have some idea of how long the virus lasts on various surfaces, but we don't really know. And I think it's going to be a while before we have a much more accurate picture or accurate understanding of how long this virus lives and how we contract. It seems so random and indiscriminate. For example, 3 people could be working very closely together. One person is infected, and only one other person become infected. They may all be asymptomatic. One person maybe. It is so random. And I think probably why, and I think you and I have talked about this in the past, Mike, part of why I think too many people are not taking it seriously is because it's so unpredictable and so random. And I think they figure, well, I don't have it. I don't know anybody who has it. I don't know anybody in a ventilator. But my understanding is a vast majority of people who are infected are asymptomatic. They can carry it, but they're asymptomatic. And I think that's part of the confusion.
Yeah, that's it. And the thing is, of course, if once we get that testing ramped up, and that doesn't mean exactly going to get tested, or I hear now they're just starting to test the first at-home testing kit. You can test yourself at home. The thing is, if you have it, you stay home. If you don't, you get to go to work. That's, in a perfect world, that's how it's going to be. But if we had more ramped up testing, I think the goal for the state is like 6,000 per day. We haven't even come close to reaching that per day yet. Hopefully we'll get there, because that's going to be the key in knowing who has it and who doesn't.
The only thing I'll add is all through this whole thing, when I look at the window, the percentage of positive versus tested, we seem to be floating right now on an average in the state anywhere from 18 to 20%, which tells me as we go forward and the additional tests are being administered, and we're still coming up with that percentage, it leads me to believe we're more than likely 20% of Indiana's population is infected. But yet that's not really substantial because we can't test the entire community. But yet then again, what kind of decisions can we make when we can't deliver those tests and come up with a true number? But right now, just the sampling, 20% is a lot, and then when we start talking about opening up communities, and we're so connected with expressways, Chicago to Northwest Indiana, even Indianapolis to Northwest Indiana. How many people have to travel down there? Now, given the stay-at-home order may have reduced that, but still, and that's the other thing that we didn't mention. We talked Menards stores, and again, Kelly and I are moving. One thing we both sat next to each other and said, "My gosh, 8094 is busier than it used to be." So what is that? It's people still are traveling and commuting, and we notice that right across the right in the Indianapolis Boulevard area, which is close to the state line. So again, it's we've got percentage of testing is not ramping up fast enough to test the community, and people are traveling. So
What's interesting, I think, especially once the governor's stay-at-home order took place, probably a week or so after that, when I was still out and about, they I saw I noticed a decrease in traffic, at least initially. I noticed a decrease in traffic, but I think it's like everything else. Something becomes so common and normal, people think, well, I'm just going to get out of the house. I'm just going to go do this. And I'm just not going to take it as seriously as I probably did at first. And yet, on the other hand, I do see it, for example, on Facebook. A lot of people are doing more stay-at-home things. I don't know who those people are that are out driving around.
yeah,
I don't know. I find it curious, though. I do find it very curious because I'm being extra cautious with my family.
and except for the move, we are too. We
Sure.
outside the move and going to get essential things that we need for the move. We are pretty much in Netflixing or doing shows out of our home, and that's the other thing that we did. We made the conscious effort to move out of this beautiful new studio that we had to our home because we didn't want to endanger ourselves or others, and we wanted to set an example.
I think one of the things people can do to kind of educate themselves is, and maybe people have done it, is going to that. I do got to say that the state of Indiana has a pretty user friendly and very nice website that shows all some of the metrics. I'm sorry, my face is looking at there. I'm looking at this other computer screen of all some of the numbers in regards to which county has the most cases and deaths, and that's never good, I'm sure. But at the same time, it's a way to educate yourself and spend a little time there. I've looked at the website for the state of New York, Florida, Michigan. I haven't seen all 50 states, mind you, but and even the state of Illinois. I think Indiana's is the best right
Yeah.
now. It just seems cleaner. It seems fresher. It seems a little bit more understandable. There's some things I would probably do different, but it would take more work on their part. Maybe just another little computer program just to break it down by what were the numbers previously in Lake County or other counties. But that's about it because they do show what the new cases are and historically. For example, if you go there, you can see hold on. Sorry about that. You can see demographic distributions for cases. So you could see the age groups who are getting this. So from about infant to 19 years old, 2% of people who are that age group are getting this virus. 20 to 29 years old, 10%, which is a little bit more than I had been seeing. Oh, actually, almost 11%, actually. 30 to 39 years old, almost 14%. 40 to 49 years old, 17%. And in that, the wheelhouse, I'm not trying to say how old we are, but that 50 to 59-year-old, almost
Watch it, Michael.
20%.
Hey.
I know you're not
Just
anywhere near
because
So-
you guys are below, what, you're in your 30s
So
still or
then,
something
so
like that?
60 to 69 years old, 16%, 70 to 79, only 10%. And this is a little bit weird, but the deaths,
That's the telling part.
that's where, 80 years old and older, almost 42% are passing away from this. 70 to 79 years old, 28%, 60 to 69, almost 21%. And at least some solace we have is that 50 to 59 years old, 6% passing away from this. And gender wise, men are beating women 55% to 41%. And it does break it down now over race, because we do know African Americans are showing a higher percentage of dying from this disease based on their population.
So
because you would,
I want to jump in about something
Yeah.
with that website, Mike, because I want to be fair. So yeah, I think it's okay to be critical of the state of Indiana's testing protocol. But to your point, there are some good things that are going on. They are doing some things right. That website has continuously gotten better. They've published way more data sets than they did before, and you're able to follow the peaks and valleys. And for example, and the regular communication that Mayor Prince puts out, we've used a lot of that data to talk about some of the trends. So we talk about, for example, the 10-year age ranges for infection rates, and then we compare that to the horribly unfortunate death rates that we're having, especially among the oldest populations. I think that the state of Indiana, with the governor being out on a daily basis, Dr. Box being in front of the public on a daily basis, with the website, I do think they have really stepped up their game on providing information. So kudos to them.
Yeah. And, some of the other things that they show is people are very concerned about the amount of intensive care unit beds in the state and ventilator uses. It shows you right there. Right now, available beds for ICU statewide is not even 50%. So more than 50% of the ICU beds currently are available. And right now, 22.5% of ICU beds are now in use for COVID-19 patients and 30% for non-COVID. So it's actually beating there. And then ventilator usage, 77% of our ventilators are available right now. I don't know if that takes into account the 34 that just arrived to Northwest Indiana just on Saturday, which are it's going to be dispersed among 17 hospitals in Northwest Indiana.
Yeah.
So 2 each, but that's added capacity. So 77% of ventilators are being used. 11.6% of ventilators are being used by COVID-19 patients, and about 11.3% of non-COVID. So that's telling you that they're trying to see this capacity. So when the state does open up, it's not that the virus is going to go away, but that they have the capacity to deal with it. And they could start opening, even what Governor Holcomb said yesterday, depending on their PPE supply that they have, then they can start opening up the dental offices again. They can start opening up the elective surgeries again, because when this thing was hitting, it was all hands on deck. We need that PPE fast. So in that regard, things are getting better, but numbers wise, we're going to see increase in numbers.
Yeah, Mike, the only thing I'll say about the ICU bed usage and ventilator usage, now this is improved, as both you said, and I got to reiterate, this has got to be the best site. And I've been doing a lot of looking across the nation, California, because I have friends in California, New York, and this has got to be the best designed site. And so I'm about to say I'll have to qualify. I bet within a couple of days or a week or so, they'll get this corrected. Now, when you look at the percentage, this is still a state average. You got to consider that, you have rural areas versus urban areas, and you have to look at that. What is your percentage in an urban area where you have a denser population? Is that the same percentage, and is that being diluted through this report? So I've got to say, that looks good initially, and it gives you an indication we shouldn't be concerned. But yet, when you look at an urban area like Indianapolis or Gary, do we have good coverage for those areas? And that's really not what this indicates. It's state average, but Indiana has got a large amount of rural areas with large hospitals. So
To offset the numbers, sure.
yeah, so but I'm not. I don't want to seem to be critical because I've got to really hand it out to these guys. I don't know who's doing the site, but they should win an award for the site design because it started out amazing and it continues to be amazing. And whoever has designed this understands data drill down and being able to go down and look at specific demographics or look at specific areas. So I assume it's even going to get better. And I hope, again, I say that and hoping that a couple of months from now we won't need this site. But yeah, that being
Well,
said,
yeah, they may get an award for the best websites, and let's not overdo it with the state of Indiana. The website is beautiful and it's nice, and they give a lot of details, but they need to put that same person on increasing the testing. So we'll
yeah,
say that the
yeah,
testing is the key. So it could look nice, and we were all like, we want to give kudos or give somebody a pat on the back where they deserve it, but the bottom line is the testing is still not where it needs to be, and it's probably not where it needs to be for all of Indiana. But we're primarily concerned with Northwest Indiana. It should be more in Evansville or Kokomo,
hmm
and but being the way Indiana is set up, Indianapolis is the state capital. It's in the largest county population wise. So that already tells you that right off the bat, they were probably going to be the central focus of this pandemic, which doesn't surprise anybody. But now, almost a month into it, those rates are climbing, but they're not where we need to be in Northwest Indiana.
So one of the things also I'm concerned about is complacency. So I am concerned that people are going to say, "Look, we're not using the ventilators. We're not using field hospitals. We're not." So this problem really isn't as bad as the media and podcasters and Facebook folks are making it out to be. Now, granted, these are people who you probably couldn't convince them of the real magnitude of the problem to begin with. But I think it's just important that Mike continue, like he's been doing, is cautioning people. We haven't seen the surge yet. We haven't seen the increase yet. So let's not get complacent.
I'm just trying to. I know my face isn't towards the camera again, but I'm just trying to get some information on testing sites because we had a question again by George Lara about testing sites, and the only thing I see locally as far as testing, they had one in Maryville a couple of weeks ago. They're still having it at St. Timothy's.
Till tomorrow.
That's according to the Indiana State Health Department website. St. Timothy, 1600 West 25th Avenue, Gary, Indiana. And that's where it's for. I think it's pretty much for pretty much anybody, long as you're symptomatic, you're a first responder in healthcare, or you're an essential worker, and or you're a family member of an essential worker. You can get tested.
That's true.
If you're symptomatic of something, trouble breathing, fever, something. And I did see where there was a clinic that was also doing COVID-19. I'm looking for that email because I don't have it in front of me. Huh?
The one in Couts? There's one in Couts that's offering the test $55 per person.
Okay.
So, I mean, it's almost like the market's trying to step in where it senses a vacuum, or just capitalize on people who are desperate enough to pay cash money to be tested. Now, maybe there's an insurance part of that, but $55 per test. A family of four in Couch would have to spend $220 just to be tested.
Okay, so then maybe Indiana State Health Department officials put on a more extensive list of where you can get tested. That's about the only thing I would say.
I know Apple is working on an app. In fact, I think it's a website now where they are creating a national database of all the test sites in the United States. So, but I'm not sure what the status of that is, if they rolled it out or not.
One other question: what about undocumented and uninsured? They are among the many of the essential workers. They may be sick, but still go to work. Um, I will say this, unfortunately, I think for many undocumented people, they're going to be out of luck as far as um, I think there are groups that are trying to help those who are undocumented get the test. I think anybody who's sick should get the test because, again, the virus doesn't care if where you live, who you are, how wealthy you are, and whether you're undocumented or not. It doesn't understand that. It just says, "There's a warm body, I could use it."
But is the
Um,
concern there if you step forward to be tested, are you going to be susceptible to ICE?
that's a good question. But if we're going to have pockets of people sick, I don't want to be an advocate for
Right.
it. But it just seems like you would want to get people who are sick tested and
Yeah.
treated
And
because again, they're here, and if they're working on agriculture, if they're working in some kind of plant, that virus can spread,
yeah,
and you may want
yeah,
to do that. But I have no information on whether undocumented. I hear that undocumented people aren't are going to get the stimulus money or the,
yeah,
the money that's supposed to come to help people. Now the uninsured, there's there's some question about that too. But Congress did pass money that is supposed to be used to help people who are uninsured get the test done. So whether I think the caveat is, and I just saw a story about it yesterday, they give the money to hospitals, but they don't tell hospitals how to use it. And I think the story had to do one of our locally based hospitals. So I think it was I'm not thinking it was Franciscan Health who had an issue. There's a story yesterday that I saw on one of the stations about a person went in, got tested, and there was a problem with the bill. He got stuck with the bill, even though there should have been money to pay for it. Shouldn't come out of his pocket. So maybe we can get somebody on with a health. We'll get somebody on, a spokesperson. Hopefully, they'll come on with the health system in Northwest Indiana to kind of explain all that because that is a concern. Because if you're worrying about cost to get tested, people aren't going to get tested, especially now when people are losing their jobs or on unemployment or not getting the benefits. You hope that cost won't come in between person getting tested and treated. You hope that doesn't become a barrier.
right. And I don't know what's going to be done about price gouging too. If private clinics out there somehow get a hold of tests and start making unfair charges towards people. I mean, and I think I saw something where either the AG has said that they will prosecute price gouging during the pandemic, people taking unfair advantage of people during this. So I'm not sure how well that's going to be enforced.
Well, gentlemen, I think we're coming to the end of this COVID-19 update. It's been, we're going on almost 50 minutes and didn't want to go too long on that. But again, just to go over some of those numbers that we're seeing, the latest numbers here, and I'll get to that. And as soon as I said that, I don't have the page on there. Some of the latest numbers for the COVID-19 as it pertains to Indiana. Here we go. 431 new positive cases in Indiana as of today, Tuesday, April 21st, for a total positive cases statewide, 12,097, 61 new deaths for a total of 630 deaths, and 67,264 people tested. Total, that's about 2,600 more than yesterday. And here in Lake County, you've got 1,227 people positive, 54 deaths. Porter County, 183 positive, 5 deaths. And in LaPorte County, 140 positive cases and 5 deaths. So, can't say exactly when we'll be back on for another COVID-19 update. Maybe not tomorrow, perhaps. I always kind of do it on the fly because of my workload and Bill's workload. We all got our day jobs. So we'll try to keep you informed. And if you're seeing this video and you're enjoying it, please leave a comment to let us know if what do you want to know? on what should we be asking our state officials, our local officials, and share it with this, share it with people in Northwest Indiana, not just to promote us, but to get the information out there. So want to thank Mike Gonzalez, spokesperson for Gary Mayor Jerome Prince, for coming on the COVID-19 update and giving us some valuable information. And Bill Moran, always thank you for hosting us now. Thank you so much.
No problem. Enjoy it. Feel
Thank you
honored
both.
he asked me to do this. Thank you. Thank you both.
Have a nice night. Stay safe. Wash those hands. Don't hoard. Drink your milk, I guess. I don't know what else to say. Thank you. Good night.
Good night.